In today's Health Connection, a new weight loss tool is now available to men and women here in North Texas hoping to shed more than a few pounds. It's a pill that you swallow, but inside the pill is a balloon that inflates in your stomach. It's meant to keep you from eating too much, and one local dad hopes that it'll keep him on his mission to lose weight.
Well, I think today went well.
Eric Wilson hopes this pill will help him get rid of what he calls his dad bod.
The so-called dad bod's in full effect, and I want to get rid of that.
He's referring to the 20 to 30 extra pounds he wants gone.
So your head back.
So today he's swallowing a pill filled with a balloon, meant to keep him feeling full so he eats less.
I've always kind of fallen off the bandwagon, if you will. And so this is kind of more of a little bit long-term motivation for me.
Here's the first balloon that we put in 2 weeks ago. Here's the second balloon that we put in today.
Dr. Sachin Kukreja says the entire procedure requires 3 balloons swallowed 2 weeks apart. The balloons are filled with nitrogen gas, and they stay in the stomach for 6 months.
After 6 months, we do an upper endoscopy where we put the patient in twilight anesthesia and drop an endoscope and pop the balloons and pull them out. Okay.
Dr. Kukreja says the procedure is for someone considered moderately overweight. Eric swallowed the first balloon 2 weeks ago and says he's already lost 10 pounds. He tells his friends that combined with diet and exercise, the balloons could be key to losing that dad bod.
They're like, you did what? So we've aptly named my first balloon Mylar, so we have a little bit of fun with that. And so I can't wait to see what they come up with the second one. Done.
All right, so what happens when the balloons are removed after 6 months? Well, it was FDA approved just last year. So in the studies, 90% of patients kept the weight off for at least 6 months, but there is no long-term data. It's not covered by insurance, and it does cost between $6,000 and $7,000.
Interesting.
It could work.
Apparently works.